You're listening to Boomers Today with your host, Frank Sampson.
Well, welcome to Boomers Today. I'm your host, Frank Sampson. And of course, each week we bring you important and useful information on issues facing baby boomers, their parents, and other loved ones. And I can't thank everybody enough for all their support. Our listeners are growing each and every day, and it's because of you. You're sharing our podcasts and with your friends and families, and I really appreciate it. Many of you are listening to the Boomers Today podcast on Apple Podcasts, Google Podcasts, Spreaker, Stitcher, pretty much every online podcast station you could get our podcast. Also on our free app, just have to go into your app store and type in Boomers Today, and you can listen to it there. And many of you go to our website also, which is boomerstodayradio.com. So again, thank you so much. And I think I believe you're sharing all this information with friends and family because we have such great guests. And today is not going to be any different. We have a special guest, Dr. Ardeshir Hashmi, who's the Section Chief of Geriatrics at the Cleveland Clinic and is the Endowed Chair of Geriatric Innovation as well. He is the Assistant Professor of Medicine at the Case Western Reserve University and the Cleveland Clinic Lerner College of Medicine. He has conducted lectures and workshops in geriatrics nationally and internationally. Under Dr. Hashmi's leadership, Cleveland Clinic Geriatrics has garnered the following milestones: age-friendly health systems committed to care excellence designation via the Institute for Healthcare Improvement, highest geriatrics U.S. News and World Report national rankings in Cleveland Clinic history, national accreditation as a top level 1 geriatrics emergency department by the American College of Emergency Physicians. Dr. Hashmi's niche area of interest is the intersection of affordable technology solutions and geriatric population health in the service of our most vulnerable populations, which we will discuss as well. So Dr. Hashmi, thank you so much for joining us on Boomers Today. I really appreciate it.
Thank you so much for having me. Really appreciate it.
Yeah. So we got a lot to talk about, but maybe we'll start off just talk about a term that is certainly used quite often, and that's how to age successfully or successful aging. And I just wanted to maybe get your thoughts on how you define that. How do you define successful aging?
Excellent question. I define it in 3 dimensions. I would say, one is brain health, our cognitive ability to appreciate the world around us, connect, communicate. As human beings, I think we are very social beings, and I think the pandemic has brought that into sharp focus, the challenges that lie within it. So I think making sure that our brain health, our supercomputer is working well, which is such a gift, being physically very robust and sort of really making sure that age is, living out that age is just a number. And then the third, I think, is probably not talked about often enough, but our emotional health, and really putting ourselves in the driver's seat for our health and well-being and life goals that we want to achieve and continue achieving because we are sound of mind and mentally sharp and physically robust. So that would be the ideal state that we would want for each one of us.
Yeah, it's I'm smack in the middle of that boomers group aging, and I hear a lot of being in the industry, in the senior services industry, we hear a lot of myths. Maybe you could share with us some of what you have heard as more common myths of aging, and maybe clear some of that up.
I think lots of common myths, but just to name a few. There's a lot of cultural subtext to, well, that's just old age, or nothing can be done about, failing memory or getting weaker as we get older, or being less energetic. Our sleep is going to get disrupted, and a lot of people just don't do anything about it, and because they believe in this myth. And the truth of the matter is that just like at any age, the more you take care of your body physically, mentally, and are proactive about planning things, there's nothing inherent about the years passing itself that will make you less mentally able or less physically robust, as long as you invest that time and energy into regularly replenishing those reserves. So I think that would be one thing. The other would be, there's this oft-repeated thing of being reactive. Well, we'll see when it happens, and I think that is not true either. I mean, I think the more proactive you are, the more proactively you're planning, not just about your mental and physical health, but everything around it, including legally, financially, planning ahead, helps support those sort of things. So I think that's another myth. Third is, I think, this common thing of like, well, there's no way for me to age successfully and gracefully in my own home. And is it that seeing a successful aging specialist? What does that mean? Does that mean that there's an opportunity for me to stay at home, or do I have to end up in a nursing home? And none of that is true. I mean, I think nursing homes today exist because we as society have failed to make that successful aging possible and have had a very reactive sort of approach. So I think those are the common myths. I think the biggest one above all of them is that our bodies, that all treatments for us should be the same regardless of age. It does change, and very importantly, we need to adapt for the 52 changes that happen between the age of 50 and 80. These are all normal, natural, physiological changes. The more we can adapt for that, the better, because that allows us to continue to remain fit and mentally sharp for many, many years.
I'd like to just add or just comment on something, you said about being at home or in nursing homes. And I think there's a perception out there that it's that decision that a family makes or that individual makes is either you're going to be at home or you're going to go into nursing, but there is an in-between stage, right? I mean, there could, what we call in the industry as assisted living. So I just wanted to get your thoughts there. So it's not necessarily having to, maybe going to assisted living. I don't think, the industry has failed. I mean, I don't know what your thoughts are there on that.
Yeah, it's a terrific question. It depends upon the trusted navigation team that you have, and I think that's what I see my role as a clinician first and foremost. There are definitely a lot of options, like you rightly said, independent living, assisted living, memory units. And when that care is done with compassion, then it works beautifully because everyone is on your team to help support you be successful. It's not always the case. There's a lot of commercialism out there, commercialization. And so that's where the trusted advisor in terms of what are those key elements that we should be looking for in any facility. I would say, there can be very fancy looking facilities, but the care that is delivered and the patience, kindness, and frankly, knowledge about how bodies sort of change over time and age, that is the key element. So we'll often encourage folks to sort of visit any of these facilities at times unannounced and sort of check it out for themselves or their loved ones. Right. And so there are those supports available for sure. There is an increasing emphasis, I will say, in trying to bring a lot of that care to the home setting and empower that. So I think that might be even the next generation forward. Not always possible, and sometimes safety becomes an issue at home, but certainly there are options. It's just really planning ahead and having a trustworthy advisor or a group of advisors to navigate through.
Yeah, I couldn't agree with you more. And, I know safety, could be an issue at home. And also, I know I was honored to have the the head of the AARP Foundation on Boomers Today, and I know they did a whole study on loneliness, which is a big issue. Would you agree that safety is part of it, but loneliness, being alone at home or not having enough engagement could possibly have a negative effect on the aging process? Would you agree with that?
Oh, absolutely. I mean, we're seeing that magnified manyfold during the pandemic, what impact social isolation can have on mental health, depression, cognitive impairment and dementia, anxiety, and that in turn can have a real impact on cardiovascular health even. And so absolutely key. We also know the other side of the coin is the more social connectivity we have, the more successfully we age. And so that social connectivity is very challenging at times to preserve or recreate, if you will, in a world that frankly, does shrink over time. We have all of us, you and I, have long-time friends, family, and that we, thrive on for social connection. And that world gets smaller. People sort of have own medical problems or they move away geographically, especially in the world that we live in. There's a lot of points of connection. So yes, absolutely. I think for that structure, that social connectivity is absolutely vital.
Right. As I said, I mentioned earlier, I'm smack in the middle of that age group that's going through some of those physiological changes as we age. Maybe you want to highlight some for us and your thoughts.
Yeah, I mean, I think the real silver lining here is how very common sense and timely interventions when you adapt for these physiological changes can actually keep you away from really significant health issues. And so one example that I would say is dehydration. Very common as we get older, just because our thirst mechanism starts to get blunted, it goes down. And so that's the body's way of, thirst is the body's way of letting us know, hey, I'm getting dehydrated. Now, if I don't get that signal, very soon I'm going to have a lot of dehydration. My sodium might go low, and that can lead to a lot of not just weakness, but mental confusion, put me in the emergency room and in the hospital. People, faint as well because they're so dehydrated. And so proactively knowing that and sort of saying, hey, even better than me taking a pill, if I timed my fluid intake throughout the day and got that ideal state 64 ounce or minimum 48 ounces a day, that's a lot of water and fluid to drink. That will help, sort of in multiple different ways. And so I think those sort of things are key. The other example that I'll give is the liver and kidney process medications differently. So just because I've been on a medication for the last, 20 years, and it was the right medication at the time, now I find that the same medicine, same dose, is hanging around my body for much longer and interacting with other medications and causing side effects. And so this conversation with a successful aging specialist and team to sort of say, hey, I'm on these 3 different blood pressure medicines, but my blood pressure is starting to stay pretty low now. Do you think I can safely reduce the dose or come off of some of them? That sort of conversation is key, because I think the fewer medications people take, while being safe, the better they feel and the better they do health-wise.
Yeah, I know I had read some information that you publish, and you call it judicious de-prescribing.
Yes.
So that's what you're referring to, that maybe
Exactly.
People just are on too many medications.
Absolutely.
Yeah, but don't you think, is that a specialty in and of itself? So no knock on general practitioners. I mean, they're wonderful, physicians, but do you feel somebody in that, older age group that's on a lot of medications, is that a specialty in and of itself, especially those that might even be suffering from some form of dementia? I mean, any suggestions? Should they just be working with their general practitioner, maybe go to a specialist? I hate to put you on the spot there, but we
No, definitely,
we deal with that each and every day.
Of course, of course. I think definitely go to a specialist, and it's not a either or; it's an and. So obviously,
Right,
you have your
right.
trusted primary care physician or family doctor that you've had for a long time, and you want that relationship, obviously. But it doesn't have. It can be supplemented. Doesn't have to be an either or by a geriatrician or successful aging specialist. Much like you would take your children to the pediatrician, right? I mean, so the unique body of knowledge, the knowledge about how the body changes physiologically at a younger age, that is the same equivalent to the older age with geriatricians and successful aging specialists. I mean, they've had special training in this. They can pick up things early and have a pretty unique focus and skill set that can add value to the great work that you're doing with your, internist or your primary care physician. If those two folks can work in partnership, the ultimate beneficiary is, the CEO of your healthcare, which is you yourself as an individual.
Oh, good advice. Good advice. So Dr. Hashmi, we're going to take I promise, just a quick 30-second break just to recognize our sponsor. When we come back, I'd like to, certainly get your thoughts on what you refer to as the 4 or 5 M's of age-friendly healthcare.
Sure.
So when we come back, we'll talk about that. So my question to all of you is, do you know anybody who may be concerned about an older driver? Well, Beyond Driving with Dignity is a facilitated self-assessment program for older drivers. This program has been designed to serve as a vital tool to facilitate older drivers and their families as they make appropriate decisions regarding the future of one's safe driving career. If the individual is a safe driver, an advisor will provide him or her with strategies on how to remain a safe driver as they progress through the aging process. If driving retirement is the appropriate decision, then the individual and their family are offered possible alternatives, resources, and a specific plan to ensure a smooth and successful transition from the driver's seat to the passenger seat. So to learn more, you can go to www.beyonddrivingwithdignity.com or call 877-907-8841 to connect with an advisor in your area. We're back with Dr. Ardeshir Hashmi, who is the section chief of geriatrics at the Cleveland Clinic. So Dr. Hashmi, as I referred to right before break, you call it the 4 or 5 M's of age-friendly healthcare. Tell us a little bit more about that.
Yeah, so thank you for asking. I mean, this is how we crystallize, our work or our team's work. What do we focus on? What is that unique focus? For us in the successful aging program, it is the 5 M's, and right at the heart of those 5 M's is the M of what matters most. And so we put our patients in really the center of it in terms of what do you want to achieve for your life goals, and how can we help support that? And so the other M's all support that matters most M. What are the other M's? Mentation, so brain health, trying to pick up early things that are changing with memory, mood, so cognitive impairment, depression, sometimes confusion from medications and hospital stays, etc. And so the earlier you can do that, recognizing that, there is no, unfortunately, cure for disease once it sets in, but there are medications to slow down the progression. We try to pick that up early so that we can do it, a lot of things and many options if you pick it up early. Same sort of thing for mobility. You want to stay physically fit and robust, and don't want to get into a situation where you're at risk of falls or fractures. And so much before that, focusing on that physical robustness and balance exercises and Tai Chi, and that is an immense benefits for both of those first 2 M's there. And medications, we've talked about the judicious deprescribing, identifying medicines that may be potentially harmful that you're taking right now, and trying to sort of find an alternative ways. I mean, not everything needs to be a medication, but for example, to try to reduce your cholesterol, I mean, yeah, medication is one thing, but that's not the only thing. Dietary changes, natural supplements, all of those are known to drive down that cholesterol. And so at the end of the day, our service to our patients and families is to make sure that people achieve their health goals. How they get there has to be something that is very compatible to each person and family. And so those, I would say, what matters most, mentation, mobility, and medications are the 4 M's. The 5th M, I would say, is multimorbidity. And multimorbidity are things that, chronic conditions that maybe no one else will talk about, vision, hearing, nutrition, and safety in terms of driving, being able to prepare one's own meals, manage medications, financial planning. So there's a lot that goes into it in sort of a unified platform, and in visits that are pretty time available and time luxuriant in terms of that availability. So that is sort of our 5M approach and focus in terms of crystallizing what our role is.
Great. Thank you for that. I do have some questions for you on technology, but before we get there, I want to make sure we don't run out of time and asking you to maybe share with our listeners how they could learn more about the Cleveland Clinic's, the geriatric program. Is there a particular website that they could go to or contact if they want to learn more? Anything you could share there?
Sure, absolutely. So the Cleveland Clinic Successful Aging Program has its own websites. If you go to any search engine and sort of type that in, you'll get to that web page and you can connect that way. I remember now that we can connect sort of virtually as well with you. Post-pandemic, that has been one of the drivers of change there. And then, I'm able to sort of, share pretty direct access phone numbers as well if need be. And that is, the central scheduling number that you'll find on the website itself.
Yeah, if you want to share that, do you want to share? Yeah, go ahead. Feel free.
Yeah, so that is, that number would be 216-445-4415 is our successful aging program number. That's 216-445-4415.
Great. So I know when I was giving a little bit about your background, and just a little bit, you have a tremendous background, but I did touch on your interest in affordable technology solutions for the geriatric population, and I myself am extremely interested in that as well. And I would love to hear your any input that you have on that generally, or any specific technology that we see on the horizon to be able to help the elderly, and any thoughts there?
Absolutely. I think we are very tech savvy as a rising boomer generation, all of us. And so I think we can take advantage of that to really assist us in staying mentally sharp, physically robust. And many technologies, specifically I would call out safety in the home setting, or really any setting, in an assisted living setting, even in terms of trying to use artificial intelligence to pick up any memory changes, any physical changes early, so that intervention can be made possible. So I think that's one. Second would be, I think the technology these days is so miniature and sort of and on a nanotechnology level that, the previous concern about, well, other people are going to know if I have a hearing assist device or if I have a life alert type of thing, that is no longer the case. I mean, now that is very microchip in nature. It is very subtle and yet superbly effective. And there is a lot that can be done. There are also things that are, a new way of practicing successful aging medicine. So using a simple cheek swab to predict, based on your DNA, which medications, specifically medications for depression and anxiety, that you will respond to, and which ones will cause side effects on an individual basis, based uniquely on your unique DNA fingerprint. So that is, very precision-based medicine sort of approach. And then, of course, the technology of connecting with resources just nationally and globally in music therapy and art as medicine and culinary medicine, all of those things provide a very holistic set of resources, balance exercises, tai chi, yoga, meditation, which are very accessible from your smartphone, your computer, through virtual visits. And so I think the possibilities are endless. But our job is to be that navigator, that connector, to introduce people to that technology. So it's very, very encouraging. The future looks bright.
Yeah, I would agree. Actually, we have had some representatives from companies on our show representing these, some of these technology companies. We plan to do more of that. It's some of it is just amazing, especially like you said, this AI, artificial intelligence is quite amazing. So, boy, I could talk to you for hours, but you don't have hours, and I don't know if people are going to listen to our show for hours. So maybe we could just wrap it up with this question. Families that are dealing with maybe some early, warning signs with a loved one, maybe their ADLs, activities of daily living. There's some changes going on. Maybe there's things going on with memory, and they're wondering, well, is this just normal aging, or is it possible my parent or spouse is now dealing with some form of dementia? I don't know. But what advice can you give to somebody in that situation, and what kind of steps you should take when you start seeing these early warning signs?
Yeah, great question. I think that is the value of the early warning system, of noticing changes with your loved one when they're driving or taking care of their finances or medications or really managing their meals. When you see that, I think early referral is very important. I think getting in touch with a successful aging specialist is incredibly important to do that in-depth assessment. And really, I think the messaging is important. You are concerned about your loved one or about your own health, and you want to message that in exactly that way, very transparently. Hey, I'm on your team. I'm on your side. I cherish and value your independence, but I want to make sure that you're safe as well. And so, want both the best of both worlds for you: quality of life and safety. And so, I think early connection is very important. I think a focus and emphasis on the right nutrition and exercise is incredibly important. And that advice also could be forthcoming. And also, I think the realization that I think a lot of people, to explore another myth that you had referred to earlier on, the affordability piece. Very, very affordable, with a lot of community partners that we have here at the clinic, both locally and nationally. And I think, especially in the world that we live today, where that social equity is just incredibly important to always have in the realm of our consciousness, we've taken active steps to do that. So these solutions that we're talking about, whether they be technology or clinical or social community, these are things that are not costly. They're eminently affordable and many times cost neutral. So I think knowing that knowledge is power, and I think your role as caregivers and as for ourselves as well, proactive measures are incredibly important.
Dr. Hashmi, thank you so much for joining us on Boomers today. I can't thank you enough, and would love to have you back in the future. So thank you so much for joining us. I really appreciate it.
A real pleasure. Thank you for having me.
Yeah, thank you. And I want to thank everybody out there for joining us on Boomers today. I ask, please be safe, and we'll talk to everybody real soon.
You've been listening to Boomers Today with Frank Sampson. To learn more about today's show, visit boomerstodayradio.com and join us next time for another edition of Boomers Today.